Good morning, friends. How are you feeling today? How you doing? Give me a word, an emoji, a comment. Let me know. I'm curious. So today I'm here to talk about headaches, and I'm sort of a headache expert. I've had lots of headaches. I actually had a headache for 8 months straight, and if you're anything like me, I just was popping those ibuprofens, the Aleve, the Excedrins, those non-steroidal anti-inflammatory drugs like they were candy. I was just taking them all the time, and it really didn't relieve the headache, and it also gave me a bleeding ulcer. So, we buy these things at the grocery store, at the drugstore. We read the instructions. It says take every 4 to 6 hours. You don't really think about these side effects, but these are some serious drugs with serious side effects. So what I want you to do is next time you're on the Google, go ahead and type in scholar.google.com right into that search engine. It's going to pull up a separate search engine from Google that actually only pulls up peer-reviewed scholarly articles. So once you're there, I want you to type in ibuprofen or whatever, and you can even just type in NSAID, N-S-A-I-D, non-steroidal anti-inflammatory drug, and health risk. And I want you to look through and get familiar with these side effects. And, I would hate for anyone else to develop a bleeding ulcer like I did. It was pretty much the worst experience ever. So don't do that. There's so many more options out there. There's a lot of natural options for us out there, and that really, really works. So I woke up with a headache this morning, and I was able to just release that headache in just a few minutes time and get dressed and get started with my day. So I wanted to share my tips with you, what I do. This is not to be taken as medical advice. This is not reflective of doTERRA's views or any other brand's views. This is my research, my experiences. So if you have questions, please reach out, and I'm so happy to help you. I use this stuff every day, and I'm only going to share things that I have personally tried and that I have also shared with a lot of my clients who have had similar really amazing experiences. So today, let's just get right into it. Headaches, what do you do? I want to know. Give me a comment. Let me know what's your go-to. Are you hitting the ibuprofen? All right, so this morning what I did, I put 2 drops frankincense, 2 drops copaiba right under my tongue, bloop, bloop. And then I also applied topically lemongrass, copaiba, and the deep blue blend right on the temples, the back of the neck, and spine. Those 2 things are like, whoop, game changer for me. I also recently started using lavender because I read this amazing study done on lavender aromatherapy for headaches and migraines. It outbeat every prescription migraine medication out there. This was really interesting. So if you're on that scholar.google.com, go ahead, type in lavender essential oils and headache and migraine, and check out those peer-reviewed studies. So my headache is gone from just that stuff, but I am also just going to do this because it's really pleasant even if you don't have a headache. So you can just take your finger at the top of that lavender essential oil, and you're just going to put a little in between the nose and the lip, and this is what they did in the study, and then you just smell it until the aroma fades, and that's also real nice for the skin. It smells so good. So lavender aromatherapy. There you go. Those are game changers. And then I also practice a breathing exercise, and this is my favorite. This is like my go-to breathing pattern when I'm feeling like stressed, headache, tension, whatever. You can do this in literally like 1 to 2 minutes, and it changes everything. This breathing pattern is called Lagima Badana, and it is known as the breath of attaining weightlessness. So before we get started, I'll just kind of explain what we're going to do. And if you can join in, please do so, but not if you're driving. We will be either seated or standing in a space where we won't be disturbed, where we can have our eyes closed, safe, quiet space. So go ahead and find that area for yourself while I just explain what we're going to do. And this is a great practice to do in your office chair, in the middle of the day if you're feeling a little bit foggy, got unfocused or whatever. In the ancient text, this breath work pattern is known as attaining weightlessness, and they actually believe that it helps connect the body and brain, and it helps our body move more freely after we practice this. So this one I'm practicing every single day, probably 3 times a day, and I highly recommend you give it a go if you're feeling headachy, head tension, stress, anything. I also highly recommend you just join me right now. So if you are able to, find your comfortable seat. Sit forward in your chair. If you're seated in a chair, I want both feet flat on the floor so that you can sit up tall, back away from the chair, and that helps the diaphragm move a little bit more freely. If you're seated on the ground, cross-legged, I recommend having like a pillow or a blanket underneath the hips so that the hips are slightly elevated above the knees. And again, we're just going to be doing this breathing pattern for 1 to 3 minutes, and it's going to just change everything. So if you're ready, I'm going to do this one standing. If you do get dizzy or something, I recommend doing it seated. But if you are standing, just grab onto like a counter or your a back of a chair or something. And we're just going to stand up or sit up nice and tall, roll the shoulders up, down, and back. Reach the crown of the head up towards the sky, kind of like you're plugging into the sky. Sit bones rooted down, or your feet just reaching into the earth. And we're just going to direct our attention inward. So we'll just practice 3 full breaths, breathing in through the nose and out through the mouth. And you can sigh. That sigh noise actually creates helps activate the parasympathetic nervous system in the brain, kind of tells all the cells like, hey, I'm okay. So to begin Lagima Badana, we will breathe in through the nose and then in through the mouth and exhale strong and long down through the nose. And we can bring in some equality to this breath by breathing in through the nose for the count of 5. Try to draw that breath into the belly. Drop the mouth open, relax the jaw, breathe in through the mouth for the count of 5. And try to fill the chest. Exhale strong and long down through the nose with the mouth closed. Coming right back into our inhale, filling in the belly for 5. Through the nose, drop the mouth open, breathe in through the mouth for 5. Exhale strong and long down through the nose. Create your own rhythm, your own pace with this breath. Breathing in through the nose, breathing in through the mouth, and then exhale strong and long down through the nose. And we'll just do 3 more rounds together. Breathing in through the nose, try to fill the belly. Drop the mouth open, relax the jaw, try to breathe into the chest for the count of 5. Close the mouth, exhale strong and long down through the nose. Breathing in through the nose, fill the belly. Breathing in through the mouth, fill the chest. Exhale strong and long down through the nose. 1 more to retain the breath. Breathing in through the nose, fill the belly. Drop the mouth open, breathe in through the mouth, fill the chest all the way up. Pause at the peak of your inhale, close the mouth, relaxing the jaw. Invite the breath to stay within the torso just for the count of 10 to 20 or as long as is comfortable for you. When you feel called, calmly exhale down through the nose, returning back to your passive breath. And when you feel ready, just blinking open the eyes here and noticing how different you feel. So please give that a go and let me know how it works out for you, and let me know if you have any questions. All right, until next time, I'm Jen Hyla. Be well.